Assalamualaikum to Madam Johanna. We are from Seras, and today we would like to make an oral presentation on suicide prevention. I am Danish. We'll start off with introduction. So basically, what is suicide? Suicide is pretty much a dangerous self-harming action that currently are very dangerous towards our society, and day by day it keep on increasing the numbers of people that involved for such action, which actually raise concern amongst us. So as you can see in my slides, it's actually a statistic shows of how many people were involved based on these case studies that I have found in an article. So next off are the causes. So there are two causes. The first one is the the thing that causes people to actually commit suicides are firstly it's about mental health disorders. There were a lot of factors that shows people that are involved in suicide or people that have a feelings of doing suicide are actually related with mental health disorders such as schizophrenia, anxiety, or even depression. So there's actually a lot of research, including the ones that I show in the slides, are scientific data that shows suicide is actually related with mental health disorder and are the causes for suicide. So the second cause are actually childhood trauma. Individuals that actually have the idea of committing suicides usually have a childhood trauma, which means that back during their childhood, they tend to have the idea or even the thoughts of doing suicide, or even they are exposed themselves during their childhood years with with the action of suicide itself. Maybe it's through media, or maybe it's actually through exposure amongst their parents or families or relatives, someone that they know socially. They know about suicide, and they will tend to have the idea of committing suicide later on in the future. So next up, I will pass to my next presenter, Shafi'i.
Hi, my name is Muhammad Shafi and I will present about solution and conclusion. For the first solution to prevent suicide is by improve access to mental health service and promote early treatment for mental health condition. For example, digital mental healthcare intervention (DMHI) is a possible solution for the growing demand for accessible care for victims of suicide that are suffering from mental health problems. It highlight how digital treatment can help individuals connect with mental health care, enhancing both the efficiency and effectiveness of care. For example, in Malaysia, like MySejahtera apps and Naluri apps not only assess mental health but also provide resource and facilitate communication with medical professionals. For the second solution is by establish and promote crisis helplines and emergency intervention service that are accessible 24/7. The National Strategic and Action Plan for Suicide Prevention was developed by the MOH in 2012 with the collaboration of WHO expert outlining main strategy. For example, mental health promotion, early detection of mental health, capacity building of primary health, about suicide prevention, as well as intersectoral collaboration with other agencies. In addition, numerous free helplines are available in Malaysia, like Miasa Crisis Helpline and Talian Kasih are two examples. The great thing about this helpline is that they are open around the clock. The purpose of this helpline is to support or counsel those who are completing suicide. Then next for the conclusion. For the conclusion, individu who have been diagnosed with mental health disorder tend to commit suicide. Furthermore, persons who are unable to address environmental challenge develop depression, which might lead to suicide. Similar natural disaster also contribute to the issue of suicide due to the trauma they face at that time. In addition, person who have experienced abuse such as physical, emotion, and sexual abuse might suffer from mental health issue. And then in a future where artificial intelligence AI is pervasive, mental health application powered by AI will provide social and mental assistance to others in a manner similar to that of a medical expert today. On the other hand, international cooperation is necessary to facilitate the sharing of our culture with other nations and to raise awareness in our local communities. Thank you.